So there were no other variables that changed. And within 1 week of going on a ketogenic diet, I would say her mental state was 70% better. And within 2 weeks, it was about 90% better to what she had been for that previous 7 months. So, and I've seen that several times over now in people severely depressed in the context of bipolar disorder, come out of those depressive episodes rapidly. That's been my personal experience.
When I was in training, I never thought that diet was important for mental health. But after seeing many dramatic transformations in patients with severe mental illness, my mind was changed. Today, we talk to the carnivore shrink, Dr. Rachel Brown, who will be discussing how and why diet could be the most important thing you ever do to improve your mental health. From ketogenic to carnivore diets, we'll explore the science behind these nutritional approaches and their profound impact on mental health. Hi, I'm Dr. Josef Witt-Doerring. It is my pleasure to be joined by Dr. Rachel Brown, a psychiatrist over in the UK, author of this amazing book here, Metabolic Madness. And today we're going to be talking about diet and mental health, but just critical views on psychiatry as well. So anyway, Rachel, thanks so much for coming on.
Thank you for having me. It's a pleasure.
Yeah. Rachel, I didn't hear anything about diet when I went through my mental health training, and it made me think that it was irrelevant to how we practice psychiatry. It's like an afterthought. It's like, so why is diet important when it comes to the treatment of psychiatric conditions?
Oh gosh, where to start is absolutely vital. And yeah, I'm the same. Nobody ever taught me about diet or how to take a detailed history about that side of things. When I went through training, all I was really taught was just to ask if somebody had reduced appetite or not, and not inquire any further. In 2021, I trained with Dr. Georgia Eade, who I'm sure a lot of people will be aware of. And she's an amazing sort of ex-Harvard psychiatrist who's been using ketogenic diets and other nutritional strategies for treating a whole range of different mental health disorders for, 10, 15 years now. And I have to say, I've seen the best patient results that I've ever seen in my entire 20-year career by using metabolic strategies with people, as opposed to the standard treatments that are offered in the form of medications.
If I was going to jump in, I mean, what is the science behind it? What does food have to do with how our brain works or our mind works? What's that link?
So a massive issue for a lot of people across a whole range of different disorders comes down to metabolic dysfunction or insulin resistance or pre-diabetes. So when people live with chronically high levels of insulin for many, many years, it essentially disturbs the brain chemistry and the ability of the brain to access the energy it needs to run. So usually the brain would run on glucose, but if you have resistance to the effects of insulin, then your brain cells aren't able to access the energy that would come from glucose. And also, I suppose another aspect is just inflammation is a huge issue across the board in different mental health disorders. And using particularly ketogenic metabolic therapy, it has powerful anti-inflammatory effects and regulatory effects in terms of certain neurotransmitter pathways in the brain, particularly glutamate and GABA. There's a huge relationship between type 2 diabetes and depression, for example. And I don't know how much detail you want, but across the board of other mental health disorders as well, there are difficulties in the form of oxidative stress, which is when we have not enough in the way of endogenous or internal antioxidants and too much in the way of pro-oxidants. And this all comes back to the mitochondria and how your mitochondria are functioning. And so ketogenic metabolic therapy can correct those abnormalities as well.
So I know you mentioned you've seen really good outcomes in patients with dietary changes, and gosh, I have too. But before we go there, what is there that's out there in the way of clinical research, and if any exists, maybe even clinical trial research with placebo controls specifically looking at diet. Can you give us a lay of the land of what you consider to be the best evidence research-wise for this?
Yeah. So personally, I think the best evidence are N of 1 real-life trials that people have done themselves or in conjunction with psychiatrists who've been using this kind of therapy. There are various trials ongoing throughout the world in different countries at the moment. None that I'm aware of that have been published in terms of an RCT with a placebo control. I was involved in a study locally in Edinburgh last year, which was a trial of ketogenic diet in bipolar disorder. But that was just a feasibility study, so it was fairly small and it was under 30 patients. And it was really just to see if people could stick with the dietary intervention. But we got some interesting results in terms of benefit for, particular benefit for a subset of those people. So I think big trials are yet to be published and unfortunately some have been closed down, or one certainly that I know of in Maryland in the last few months. So that hit the press quite prominently.
Mm-hmm. Tell me, what do you think is going on behind the scenes that, we've got doctors like yourself, Georgia Eade, Chris Palmer, myself, I've seen these results as well. Clearly diet is helping some seriously chronically ill patients come off these medications. I've just seen it, but there seems to be so little in terms of mainstream interest in this, research interest from academic institutions. Just share your thoughts. What's with the disconnect that we're seeing something that's working, but there's so little backing and interest from the establishment?
I think that comes down to pharma funding a lot of studies in universities. And I think there hasn't been a trial there haven't been any trials until fairly recently, because there wouldn't really be any interest from the pharmaceutical industry in a dietary intervention, because it wouldn't be a patentable, profit-making pill that they could give people, to put it bluntly. And I think all the research that is going on at the moment is due to the Bouzouki group largely, and that came from a personal experience, a family member within that family really benefiting from following a ketogenic diet to treat their major mental illness, which was bipolar disorder. So really it's coming from philanthropic funding. But I'm glad it's happening now.
I'm so critical of how much we use medications here, and I could never see dietary interventions being rolled out in medical practice in the US. It takes too long. It's too complicated. You have to motivate people. And it's simply just not the way our healthcare system is set up. We want very quick transactional visits. That's the way we care for people. And there's a lot of incentives from the insurance companies. There's also a lot of marketing from the pharmaceutical industry that hypes the drugs and makes patients request them. And so I do see these forces at play. I want to dive into some cases that you've seen. I think that could be really neat to touch on early on. Tell me about some miracle transformations that you've seen with diet.
Okay. So I often think of the very first person that I ever treated using metabolic therapy within the NHS. And she's a lady with bipolar disorder, and she'd actually been under the crisis service for 7 months, which is an incredibly long time to be under a crisis team. And she had a severe agitated depression that just wasn't getting any better. And she wasn't particularly a big fan of medications, although she did try several different types, and nothing seemed to be shifting the dial at all in terms of getting her better. And eventually, after quite a number of months, she agreed to give a ketogenic diet a try. There were no changes. So she'd been on lamotrigine for many years. We made no changes there. And otherwise, other medications had been started and discontinued because of side effects. So there were no other variables that changed. And within 1 week of going on a ketogenic diet, I would say her mental state was 70% better. And within 2 weeks, it was about 90% better to what she had been for that previous 7 months. So, and I've seen that several times over now in people severely depressed in the context of bipolar disorder, come out of those depressive episodes rapidly. That's been my personal experience.
You talk about bipolar disorder. How does it fare with other psychiatric diagnoses?
So I think it's promising. My personal experience, though, for whatever reason, has been more people with bipolar disorder coming through the metabolic clinic that I started within the NHS. And I think that might relate in part to the fact that the local professor who was involved in the study I was involved in last year has a specialist bipolar disorder clinic. So a lot of referrals would come to me that way. I've had people with other diagnoses and had mixed results, partly because a lot of people deal with food addiction issues and don't actually manage to undertake the diet and stick to the plan. So that's a major sort of rate limiting factor, you might say. And I've had other people as well who've not responded particularly well, one more recently, but I think there are other reasons for that, because they had been prescribed medication that caused quite severe akathisia. And I just wonder if part of the presentation at the moment in terms of depression might relate to withdrawal symptoms as opposed to,
correct. Yeah.
I don't think it's a straightforward depression that we've been treating. So it's probably an unfair test in terms of hoping that keto will just turn things around within a week or two there. Yeah.
I mean, it's not realistic that if someone has neurological damage because they've had a withdrawal injury, that may be improved by the diet, but it's not going to reverse it. I mean, I was skeptical about diet for honestly up until a couple of years ago, even though I knew people were talking about it, even though I'd heard about lots of people saying, diet is amazing, it's going to make these changes. I still was skeptical until I started doing deprescribing, because I would have people turn up looking for my help coming off these medications who had fixed themselves with diet. And I would ask their histories and I would hear from them. One of them is my coach, Trudy Slort. She works with me now. She had a history of schizoaffective disorder. They threw the book at her. They threw the big purple DSM at her. She had everything. And for 20 years, she rolled through antidepressants, mood stabilizers, antipsychotic, multiple rounds of ECT until she started doing a ketogenic diet. And while on meds, while nuked with meds, she started to feel remarkably better on the diet, and slowly came off over several years and just celebrated her 5 years off meds. And she's going to medical school. Well, that's her plan. And it's completely been life-changing for her. I had another young girl who I just started working with now. She's in her 20s. And I think for the last 7 years or something like that, again, schizoaffective disorder diagnosis, they threw the book at her, on clozapine, had ECT. And for those of you who don't know, clozapine's like a really intense antipsychotic. It's kind of like the apex predator of antipsychotics. When there's nothing else to give someone, you give them clozapine. She changed her diet, everything went away. And now we're doing an antipsychotic taper with her and she looks awesome. It's these people, these goners, these people that you just think there's no way they're ever going to come out of it. I've seen it happen, and and now I'm really interested.
Yeah, no, that's amazing. I had someone not that long ago with a schizoaffective diagnosis on, 6 or 7 different psychotropic medications, and they're one of those known as one of those revolving door patients, so constantly in and out of hospital and out of crisis care. And that particular person wouldn't change their diet, but they were at risk of having to go back into hospital again. And so I spoke to them about metformin, which is a drug that reverses insulin resistance. So it sensitizes you to insulin again. And because he wouldn't think about changing his diet, we discussed the pros and cons of that. But anyway, started him on that medication. And again, within 2 weeks, he was significantly better and he never ended up in hospital. He went back to his community team again. And the thing I struggle with quite markedly now is the fact that we do have research showing that insulin resistance predicts deterioration in certain psychiatric disorders. I would argue probably all of them, but the research we have is specifically in bipolar disorder and more severe and enduring, such as schizophrenia, schizoaffective disorder, because there's a researcher and clinician, Dr. Cynthia Calkin, who's published a number of papers now, and they were able to demonstrate that insulin resistance gives you a leaky blood-brain barrier, which means the protective mechanism for your brain has gone, essentially, and then environmental toxins and inflammatory immune molecules can get into your brain and cause inflammation and chaos. And they were able to demonstrate that when they reversed the insulin resistance, that people went into remission again and their symptoms improved. And the thing that I struggle with most now is most people I see within NHS psychiatric services are struggling with metabolic syndrome and metabolic dysfunction. And yet our standard approach is to put them on medications such as clozapine, which in themselves cause insulin resistance and cause diabetes. And so if we have research now showing that if you reverse the insulin resistance and reverse the diabetes, their mental health will improve, my question is, why are we using these medications as standard that ultimately worsen the situation overall?
And to recap, just to make sure that I've got the point down, insulin resistance, so it not only disrupts the blood-brain barrier, allowing molecules from our bloodstream, which come in from the environment to affect our neurons and cause symptoms. So it's doing that. Yeah. But to bring it back to what you said at the beginning, it's also preventing the neurons from being able to pull glucose in and use it as energy. So they're energy deprived now as well, right?
Yes. Yeah, that's correct.
Okay. Good.
So you can have a brain swimming in glucose, but your brain cells are unable to access it if your insulin isn't working properly. Okay. And that's why ketogenic diets are so helpful, because ketone bodies act as an alternative fuel source for the brain. So they can go in and fuel the brain where an insulin resistant brain, where glucose is unable to fulfill that job anymore.
And for people maybe coming into this right now who haven't heard the term ketogenic diet, could you give a very just a straightforward explanation for what is a ketogenic diet?
Sure. So a well-formulated one is a whole foods, so no processed foods, but whole food, very low carbohydrate diet. So we have three major macronutrients: carbohydrates, proteins, and fat. And so you're basing the majority of your diet around fat and protein. And so in terms of limiting carbs, you're really talking about getting down to about 20 grams of carbohydrate per day. And for most people, that's a massive change to their usual diet, because a lot of people, certainly over here, are living on breakfast cereal and sandwiches and bread and sweets and, sugary drinks and you name it. All of that is carbohydrate. And
what happens with the ketogenic diet that reverses this insulin resistance?
When you lower your carbohydrate intake, and you need to avoid seed oils as well, so that's another topic, but you massively lower the amount of insulin that your body needs to produce. And so insulin resistance happens over quite a number of years. Most people at the point of being diagnosed with type 2 diabetes have had high levels of insulin probably for a decade or longer. And so we could pick these people up very early if we were doing the right blood tests, but we don't do those. So type 2 diabetes is insulin resistance. And what happens is when you live with very high levels of insulin for many years, eventually your body just becomes exhausted and cells become resistant to the effects of insulin because they've been just swamped by insulin for so many years, that they become resistant to the effects of it. And so when you remove the stimulus to produce insulin, then it allows your body to sort of readapt and recover, essentially. And so you massively lower your insulin levels, and then over time you can restore sensitivity again to the effects of insulin. It's all to do with inflammation as well. So being insulin resistant is an inflammatory state, as is having metabolic syndrome or obesity. So they're not exactly synonymous terms, but there's a lot of overlap between the three. So it's ultimately about reducing inflammation in the body and the brain.
Yeah, I've talked to Georgia Reed, and so I am familiar that there's these diets there's more parts to them. And so, one is, with a ketogenic diet, combating insulin resistance. But Georgia also talks a lot about like soft keto, where you actually remove certain foods that are inflammatory. So you not only do you do a ketogenic diet, then you remove other foods. Can you tell me about that? How would you explain that to an audience who may not be familiar with that there are these other foods out there that may also be harmful to your mental health?
Yeah, so the first one that comes to mind is the seed oils, sometimes known as vegetable oils. Mm-hmm. And they are industrially, chemically processed oils that come from industry that really have no place in the human diet, but were introduced in more recent years. And we've all been told that those are heart healthy and better for us, and we should be avoiding saturated fat and cholesterol. Meanwhile, the health of the nations have just worsened and worsened over time. But the problem with the seed oils is that they're very high in an omega-6 fatty acid, and omega-6 fatty acids are inflammatory, whereas omega-3 tend to be anti-inflammatory. And our modern diets are far too high in omega-6 than they should be. And so this just tips the omega-6 to omega-3 ratio way off and promotes inflammation in the body. But the omega-6 fatty acids have other problems as well. So the brain can metabolize linoleic acid, which is one of the omega-6 fatty acids that's hugely detrimental and very high within seed oils. And when it does that, it increases oxidative stress within the brain. So I remember hearing Georgia Reed giving a lecture specifically on that last year, I think it was. So there are all different reasons why these oils just aren't fit for consumption, really, and do appear to markedly increase the risk of all sorts of chronic health conditions, including mental health. Mm-hmm. And the next food I often think about is gluten, because one of my main interests is the gut-brain connection, and our gut health is massively important for our mental health as well. And food like gluten gives you leaky gut. So gluten interacts with the intestinal wall and opens up something called tight junctions or gaps in the intestinal wall. And it means endotoxins, so toxins from bacteria in the gut and other compounds, can leak across into the bloodstream that then triggers off an immune system reaction. And we know when you have leaky gut, you're more likely to have a leaky blood-brain barrier. So I often say to people, leaky gut equals leaky brain. And so that puts you at higher risk of experiencing mental health symptoms as well. Because if your brain isn't protected, then you can have immune system activation of resident immune cells in the brain as well, called microglial cells. So there are all sorts of different mechanisms by which just very certain food, specific foods can be problematic. Another
thing that I've also wondered about is the difference between organic produce, meats, vegetables, and non-organic food. Do you believe that has an effect on your mental health?
Oh, yeah, I think so. So I think glyphosate is probably one of the biggest issues when it comes to non-organic foods. I think some countries are worse than others. But we know that has an effect in the gut.
Just for the audience out there, what is glyphosate?
So it's a pesticide.
Okay.
And it takes out a certain pathway within the gut. I've forgotten off the top of my head, but Dr. Stephanie Seneff is a researcher in that area. When people can find interviews of her online, it's very highly detailed work that she's done in this area. But it's certainly an issue when it comes to autism. And obviously, I don't know about you, but I've just seen absolutely skyrocketing rates of autism, certainly in my day-to-day job. Mm-hmm. So there are all sorts of environmental toxins, such as pesticides, are issues as well.
And what about in animal produce? What's concerning about either organically raised animals versus, I guess, the other ones? What should people be worried about there?
So again, the pesticides. So we store all of these environmental toxins in our fat, and that's what animals do as well. Our brain is a fatty organ, so there should be some concern about us storing some of those environmental toxins in our brain. Ultimately, if we have a leaky blood-brain barrier and they manage to get in there. But when you're eating animals that have been given lots of antibiotics and subject to pesticides within their food, I suppose in theory that could be stored within the fat of the animal that you're eating. Having said that, I know lots of people who have switched to following a specifically carnivore ketogenic diet, and they're not necessarily all living on grass-fed, grass-finished meat, and a lot of people are thriving. So it's difficult to say to what extent people need to worry about that, but it's certainly a consideration.
Yeah, I mean, it may be something almost like a, I don't know, I think about it like maybe a thermometer. If you have multiple hits from different things, eventually it will cause the temperature to rise to a point where it's problematic. But if you're just having a few things coming in, you may be able to accommodate for that without a lot of symptoms. Okay.
Yeah, agreed.
Yeah. So for the listener out there who's just thinking, oh my God, there's all of these dietary related things that I should be aware of. This sounds really complicated. How do you make it simple for them, if it is possible, in terms of interventions that someone could do at home, in terms of moving towards a brain healthy diet?
Yeah, so if somebody is completely new to all of this, they could look into paleo diets. There's often a process that a natural process people come through. So often people find improvements in their health if they adopt a Paleolithic diet. There's plenty of information out there about that. That's not necessarily a low carbohydrate diet, but it is a whole foods diet. So removing all of the processed foods. And it's usually the processed foods that have these harmful seed oils within them. In fact, it's very hard to find a processed food that doesn't contain seed oils in the diet. So removing processed foods would be a really great first step for a lot of people. And then you can progress on to primals, a similar idea to paleo, although it includes some dairy. But it's really just about trying to gradually reduce carbohydrate intake. And it is about learning a new repertoire of meals. So it can be quite a change for a lot of people. But, somewhere within the paleo, primal, and then eventually keto sphere, they're all good places to start potentially.
When would you recommend someone try a carnivore diet as opposed to just staying on a ketogenic diet?
I think if they're not getting the health benefits from a ketogenic diet, if they want to try and level up one and see if a carnivore diet brings about further improvement, that would be a good time. I don't know that everybody needs to be fully carnivore, although I certainly see most health improvements within the carnivore community. Mm-hmm. But I think if a ketogenic diet's working for somebody, it doesn't necessarily mean that they should change that. I think you just need to be your own judge and your own gauge of where your health is at and where you want your health to go to know whether you need to make any further changes.
Now, I believe you're known as the carnivore shrink. And so I have to ask you, are you on the carnivore diet?
I am. I've been carnivore for over 5 years now.
Okay. Tell us, what does a day of eating look like for you?
So it's changed over time since I started, but I mostly center my diet around red meat. I do eat pork, I eat eggs. So I tend to have 2 meals a day, and I would eat, sausages and eggs for breakfast. And then I would eat steak or burgers or something later on in the day for dinner. And I do have dairy in my diet. Some people don't manage to tolerate that, but I'm okay with butter and a bit of heavy cream. So it's pretty high fat, animal-based diet that I follow.
What did you notice about your physical and mental health when you transitioned into the carnivore diet from how you were eating previously?
I went into the carnivore diet purely out of curiosity. So I didn't think I had any major health issues that I needed to do that kind of diet, but it was just, I've always been fascinated with diet, and I had watched a couple of key influencers, talk about their own experiences and lecture on the subject and how broken the research is that we have in relation to diet. And so I did it purely out of curiosity. And then I've had so many benefits myself that quite early on I decided I was just going to carry on doing it. And I've never looked back, really. So all throughout 2020, 2021, I don't think I was sick once. I used to come down with the common cold quite frequently. And so my immune health or terrain, whatever way you want to frame it, definitely improved that way. I had body composition changes that were favorable. My exercise capacity noticeably increased. What else has happened? I don't know if it's the carnivore diet or if it's age and wisdom and experience, but I feel as though my confidence kind of increased, and I've never been particularly troubled by anxiety, but, I think probably in retrospect, I feel more confident speaking like in public places, and there's a bit less social anxiety than I might have had before, that kind of thing. You look stunned by that.
Well, I am a little bit, because that sounds amazing for someone who didn't even know that they were having any problems. It was almost like you were kind of lulled into, this is normal, how I feel, how my body is, how my mind is. This is just what I'm used to. And it took going through the diet and then feeling better to realize, oh, wow, I really was weighed down by things. And then I was also kind of jealous because I just had a cold, and I was like, damn, maybe I should do this this carnivore diet.
You're probably detoxing. It's fine.
Yeah.
No, one thing I forgot to mention, and I should because it's a big piece of my story, is that I'm a major sugar addict, and I had some insight into that, but I didn't fully appreciate it was an addiction until I went carnivore. So I grew up in the 90s when it was all low fat. I've got such a sweet tooth. And so I was low fat everything for years and years and years, and just struggled to control food. And for many years, I thought that I was an emotional eater, and I read every single book going on that subject. And I'd been primal, so including dairy, so like paleo with dairy for quite a number of years before I went keto. And keto really improved my relationship with food significantly. But carnivore took it to a whole new level. So it removed any preoccupation around food whatsoever. And it just made it very easy for me to know what my satiety signals are, and to be able to, it just completely revolutionized my relationship with food. So I eat for hunger, not for entertainment anymore. And I realized in retrospect that I hadn't been an emotional eater all that time. It had been an actual food addiction type issue that I'd had. That was a struggle in my 20s, and certainly into my 30s, probably a bit less so, but that was a big thing for me.
Thank you for sharing that. Yeah. I'm going to segue now and kind of take this in another direction. Before we started recording, you had mentioned that you'd had this kind of change in perspective on psychiatry and how it was being practiced in 2020. As a doctor, as a psychiatrist firmly outside of the mainstream, I consider myself to be. I'm always interested in other people's stories. How did you come to that? How did you come to wanting to drop your prescription pad and wanting to help people with diet? What was that story?
Gosh, I sometimes wonder myself how it came about, because I think in retrospect now, I've been working in psychiatry for 20 years. All through my training, I don't think I questioned anything. I just blindly accepted what I was being taught in terms of Royal College curriculum and exams. And I think because you always have a goal that you're constantly working towards in terms of passing exams and then different things you have to do to ultimately finish your training and become a consultant, I had no real concept that we'd been lied to about anything at all in life at that point. So I was very naive, essentially, is what I think. And then 2020 happened, and the last 4 years have been absolutely crazy. And are you aware of Ivor Cummins?
I was going to say, what happened in 2020? What was the thing that made you break out of being, I guess, a more mainstream psychiatrist and then embracing this side of things?
So, I mean, in terms of 2020, I've been quite a follower of Ivor Cummins for many years because he's been in the whole keto space, real food, metabolic health, and that's how I knew him. And then he started reporting on the statistics in relation to, the virus in 2020. And the more I watched of his factual data reporting, the more I realized, nothing was really adding up in terms of what was in the mainstream media and what we were told was happening at that time. Lockdowns intuitively didn't make any sense to me. I had major concerns about the harms of lockdowns. The NHS was bizarrely quiet throughout that whole time. So I was working in the crisis team and hardly anyone was coming up to be seen. Hospitals were empty. And I don't know, just one rabbit hole has led to another. And I had known for a while that we'd been lied to about food and what food was healthy for us and what wasn't, in relation to the dietary guidelines being completely flawed and not based on any sound evidence. And I knew that there was industry corruption around the way those dietary guidelines were written. But 2020 just led on to discoveries about other corruptions more widely, and I'm still going down new rabbit holes every week. It's difficult to know which one to pick and what to talk about.
Well, I mean, it sounds like COVID and the vaccines was the kind of the crack in the door.
I was just going to say there are other aspects as well. So personally, the stuff that's happened in my life that opened my eyes as well, in terms of, I had a dog that we lost last year, but she had major autoimmune illnesses. So she was very ill at a young age and was paralyzed from a rare autoimmune disorder. And it's actually her health journey that's taught me an awful lot. And that's what led me to go into functional medicine. So I realized on her health journey that she'd been over-vaccinated and had gut issues, colitis, as a result of her diet and also medications that she'd been given. And I ended up going down the whole holistic, essentially the equivalent of functional medicine route, but in the veterinary world. And so there were parallels between what was going on more generally in life with 2020 and my own journey and diet, and then also what I saw happening in my animal's life. So there's been quite a few different paths to where I am now.
Tell me about we talked about diet, you talked about a loss of faith in the medical establishment with regards to COVID. When did you start looking at psychiatric diagnosis and medicine and how you'd been treating people and prescribing the meds? What was that journey like for you? Look, because you've been doing it at that point for like 15 years, just kind of, I imagine, going through the motions like I did during my training. What was that like when you started to look at that? How did that happen? That
was actually 2020 because we didn't have much to do in the workplace. I decided I'm somebody who always needs to be doing something. I need to be learning new things. And I decided to study functional medicine and completed that in 2020. And that opened my eyes to a completely different way of looking at health conditions. So trying to think about the root causes of any health condition, as opposed to pigeonholing somebody into a diagnosis, which is ultimately to prescribe a certain treatment, medication or drug. And so I've ended up in a place where I have a lot of cognitive dissonance. So there's tension between how I would view things from a functional medicine perspective versus being an allopathic doctor and working within the NHS. And functional medicine essentially taught me that what we do within mainstream psychiatry is incredibly simple, and very simplistic is what I would say. So we don't think about people's metabolic health. We're not necessarily thinking about too much trauma-informed care or what their backstory might be in relation to relationships within their life. Everything just seemed, the only tool at my disposal in allopathic medicine seems to be to prescribe drugs. And if one doesn't work, it's another. And sometimes it's multiple drugs and then a drug for the side effects. And it's a very difficult place to be, sort of having other knowledge now about a completely different way of looking at things.
And how's that journey been for you since you've changed tack and you're moving and you've got all these new beliefs? You're a psychiatrist working in the mainstream. Now, you have very different beliefs. How's that transition been?
Difficult, to say the least.
Yeah.
So I'm still struggling with it. From a functional medicine point of view, I don't know how much I agree with the diagnoses that we make within general psychiatry. So when you start to look under the hood, there are common underlying mechanisms for all mental health disorders, such as metabolic disturbance or oxidative stress. So there are studies showing that people with personality disorder have higher rates of oxidative stress. People with PTSD do, people with depression do, schizophrenia, bipolar. And you just start to question. And I suppose the other thing that's always made me question somewhat our diagnostic system is the fact that you could see 3 different psychiatrists and get 3 different diagnoses. And maybe that's being a bit facetious, but I think it's not that far from the truth.
No, I mean, when the DSM did their field tests, and a field test is it's a test that diagnosticians use to see how to see whether doctors will diagnose the same patient with the same condition. The inter-rater reliability for depression was 28%. And so that means that 2 different doctors would only diagnose the same patient with depression 28% of the time, which is terrible. I think borderline personality disorder was like at 58% agreement between them. Mm-hmm. But yeah, things like depression you're less likely than chance to have 2 doctors agree on that diagnosis.
Yeah. Well, yeah, I mean, I've always, it's terrible. It's horrendous. I've always had a real issue with over medicalization of a lot of the time what are social crises or social difficulties or difficult circumstances. And I don't know, I don't see the best responses to antidepressants. I could go on and on. There are lots of different aspects that just make me question a lot of the mainstream paradigm.
I'm trying to think, and I don't have additional questions for you at this time. So I want to ask, is there anything I haven't asked you about which you'd want to share with the audience before we wrapped?
My main message to people is that I think there's always hope. And even if you've been through countless numbers of drugs and doctor's office visits, I think it always pays to just do your own research. And there are other professionals out there who can help in different ways that maybe just aren't being thought about in the standard care system.
Tell the audience what you do in terms of helping people and how they can get in touch with you if they want to work with you.
Sure. So I do some one-to-one functional medicine assessments, which is really trying to find the root cause if people have had persistent difficulties. A lot of people I see within that work have been symptomatic for many, many years, have tried lots of different medications without much success. Some have had adverse effects from medications, such as PSSD, for example, is one thing that I see in my one-to-one private work. But really what I try to do with people is to optimize their metabolic health and then think about other relevant factors from a physical point of view, mostly physical. So underlying, toxicities, or inflammation and thinking about health more generally. And part of that can involve more detailed diagnostic testing, but it doesn't necessarily. So I work with people using naturopathic and lifestyle interventions, so not medications. And then I also specifically am running a coaching group now for people with bipolar disorder and helping them overcome bipolar depression. So that's another way that people could work with me.
If people want to find you to work with you, is there a website or a social media handle that they could follow to find you?
Yeah, so probably the best one is Instagram, and I'm Carnivore Shrink on Instagram. Or my website is rootcausepsych.com.
And I'm going to plug your book here, Metabolic Madness, as well. A really great introduction to the topic, and check it out if this is of interest to you. So, all right, Rachel, thank you so much for coming on and speaking with me.
Thank you for having me.
Thanks for watching. If you're interested in more content like this, I would recommend you check out our interview with Dr. Georgia Eade.